our student nurses. Our drug for this episode is Beclomethasone. Beclomethasone dipropionate is a glucocorticoid, anti-inflammatory, and anti-asthmatic drug. It has a brand names of Qvar, Qvar Radihaler, Beclovent, Banseril, Qnasol, Becanus AQ, Vansinus AQDS, and Vansinus AQ. It is indicated for the long-term control of bronchial asthma, allergic rhinitis, and prevention of recurrence of nasal polyps. Its mechanism of action is it inhibits bronchoconstriction, decreased mucus secretion, and decreased response to seasonal perennial rhinitis by altering the rate of protein synthesis, altering the rate of migration of polymorphonuclear leukocytes and fibroblasts, and reverse capillary permeability. It is absorbed from pulmonary, nasal, and GI tissues with 87% protein binding, metabolized in the liver, and eliminated in the feces. So student nurses, to ensure patient safety, here are the must-to-know information such as drug contraindication, normal side effects, adverse effects, and nursing considerations. To start off with the contraindication, it is contraindicated to patients who are hypersensitive to beclomethasone. And it is used with caution to patients with acute exacerbation of asthma, status asthmaticus, thyroid disease, hepatic and renal impairment, cardiovascular diseases, diabetes, glaucoma, cataracts, myasthenia gravis, and seizures, and for patients who are at risk for osteoporosis, and patients with peptic ulcer, ulcerative colitis, and those patients with history of acute myocardial infarction, and elderly patients. Now, let's go to the normal side effects of beclomethasone, and there is no need to report to the doctor for these symptoms. For frequent use, throat irritation, dry mouth, hoarseness, cough, nasal burning, and mucosal dryness. For occasional use, localized fungal infection or thrush, nasal crusting with epistaxis, sore throat, and ulceration of nasal mucosa.
For the need to report symptoms or the adverse effects is acute hypersensitivity reaction. If urticaria, angioedema, and severe bronchospasm are observed, assess the patient and report it immediately to the doctor. And the last but definitely not the least is the nursing responsibilities before, during, and after administration of beclomethasone. First is ask patient for history of allergies to beclomethasone, history of any disease listed in the caution list, and pregnancy. It is important to ask patient if she is pregnant because beclomethasone is pregnancy category C, which means it should not be given during pregnancy. Next is to conduct physical assessment to gather baseline data. And lastly, teach patient of the following information. Beclomethasone is prescribed to prevent asthmatic attacks and not during acute attacks. That is why it should not be used regularly as prescribed. It may take several days to produce full benefit, so do not stop medication. And before administration, clear the nose from secretions and blockages. A decongestant may be used prior to the administration. Allow at least 1 minute time interval between puffs, and if using inhalant bronchodilator other than beclomethasone, use it several minutes before administering beclomethasone. And after using respiratory inhalant, rinse the mouth well. Also, teach the patient of its common side effects and its adverse effects, which needs to be immediately reported. During administration of beclomethasone, a nurse should observe the rites of administration and follow the proper use of steroid aerosol. And lastly, after administration, document the data and monitor and evaluate patient for adverse effects. That's it for beclomethasone. We hope you learned something and see you in our next episodes. Bye!